So let's talk about one of the most ambitious healthcare projects happening anywhere on the planet right now. We're looking at India's massive mission to build a single, unified digital health system for nearly 1.5 billion people. Let's dive into how they're planning to pull it off. I mean, just think about it for a second. How do you even begin to manage healthcare for a population of that size? It's a truly monumental question. And the answer India is betting on is a complete digital transformation, one that connects every single citizen to their own health data. But before we get to the solution, we really have to understand the scale of the problem they're trying to solve. And we're not just talking about big numbers here. We're talking about deep, complex challenges that have been around for decades. So, the biggest issue has always been this incredibly fragmented data landscape. Just imagine your entire health history, every prescription, every lab result, stuck in dusty paper files in different clinics, maybe even in different cities. It's totally inaccessible when you need it the most. The goal? To replace all that chaos with a single unified system. And on top of those logistical nightmares, you have this unique and really complex disease burden. Take a look at this number: 101 million. That's how many people in India have been diagnosed with diabetes. It's a staggering figure, and it points to a massive public health crisis all on its own. And this is where it gets really complicated. India is essentially fighting a war on two fronts. You've still got infectious diseases like TB and malaria, but at the same time, there's this huge surge in lifestyle conditions like heart disease. It's what experts call a double burden, and it puts an immense strain on the entire system. So, you've got this immense challenge. How on earth do you tackle it? Well, you need an equally bold solution, and that solution is a full-scale digital health revolution. The answer is called the Ayushman Bharat Digital Mission, or ABDM for short. It was launched back in 2021, and its goal is nothing short of creating one single interoperable digital health ecosystem for the whole country. And really, the mission's official vision says it all. But the key phrase in there, the one that matters most, is universal health coverage. The ultimate goal here is to make quality healthcare accessible and affordable for every single citizen, all of it powered by technology. Okay, so this all sounds great. But what does this massive system actually mean for you, the individual? Well, it's all built on a few core ideas that, and this is crucial, put you in complete control of your own health information. It all kicks off with your health ID. The best way to think of it is like a universal digital key. This one unique ID lets you securely access and link all your health records, no matter which hospital or clinic you visit, anywhere in India. And that health ID is what unlocks your personal health record, or PHR. This is basically your entire health story collected over your whole life. It's like a secure digital file cabinet with every report, every prescription, all in one place. And you and only you control who gets to see it. Now, here's a key technical term that's really important for privacy: federated architecture. It sounds complicated, but the idea is simple. Your data isn't all dumped into one giant government server. Instead, it stays right where it was created, at the hospital, at the lab. Think of them like different local libraries. They only get linked together when you use your key and give explicit permission. And this whole system is built on one simple principle: your consent. A doctor can't just look at your records. First, they have to request access. You get a notification on your app. You decide to approve or deny it, and you can even set a time limit. You are always the gatekeeper of your own health data, period. So, this digital foundation isn't just about organizing the data we have right now. It's about setting the stage for something much bigger, transforming the future of healthcare with artificial intelligence. See, by creating this standardized digital ecosystem, India is basically laying the perfect groundwork to harness AI on a national scale. The big goal here is to use AI to democratize expertise, to bring better, faster diagnostics to literally every corner of the country. And to make that happen, the National Health Authority is teaming up with top institutions like IIT Kanpur. Their whole focus is on building AI that you can actually trust. For example, creating models that can analyze a chest X-ray for signs of TB, all trained and validated on real Indian health data, which is crucial for closing these big gaps in care. All right, so let's connect all the dots here. We have the data, we have the AI, but what does that actually mean for people's lives? The whole point of this is to turn this massive tech ecosystem into real, tangible, life-changing impact. This really shows the entire journey, from beginning to end.
It all starts with your data, collected securely. Then, AI models analyze that information to help provide really accurate diagnostics. And that, ultimately, leads to better, more personalized treatment and hopefully improved health for millions.
Of course, this is not going to be easy. There are major challenges ahead, from guaranteeing data privacy to just getting doctors and citizens to adopt the system. But the solutions are baked into the design. Things like security by design and making the entire program voluntary are meant to build that crucial trust from the ground up. You know, when you step back and look at it, India's digital health mission is one of the biggest experiments in public health in the 21st century. It is a monumental undertaking. And if they can pull it off, it could do more than just transform healthcare for 1.5 billion people. It just might become the blueprint for the future of universal healthcare everywhere.